Hi everybody, I'm Dr. Varol Togay. I'm a cardiologist and electrophysiologist at Los Robles Hospital. The purpose of this talk is to give you a few pointers about heart health and how do we protect ourselves from coronary artery disease. First, factors that can be quantified are your cholesterol levels. Do you smoke or not? Do you have diabetes or not? Or do you have any family history or not? These we can quantify. But unquantifiable factors that contribute to coronary artery disease is stress. We don't know. There's no lab value that quantifies your stress level. So in my humble opinion, genetics and stress is probably the most powerful etiologic factors for coronary artery disease. Other than that, of course, smoking is a big factor. So what should we do to protect ourselves from having a heart attack? Number one, we should stop smoking. No smoking, any kind of smoking, including vape and cigars, because this is a question that people ask me all the time. I'm vaping or I'm smoking a cigar. The answer is no, you should not smoke any kind of tobacco. Risk of smoking is about 5 times more than a non-smoker's risk. Therefore, smoking is at the top of our list that we should avoid. Second risk factor is cholesterol. And American College of Cardiology puts out these guidelines every year, and American College of Cardiology's recommendation for best heart healthy eating is Mediterranean diet. It is proven that people in Mediterranean countries have statistically less incidence of coronary artery disease, and it's attributed to Mediterranean diet. It's a specific diet where, of course, vegetables are a primary source of energy, and olive. So I would highly recommend people above age 50 to stick to Mediterranean diet, and also we should watch out our calorie intake. Our daily calorie intake should not exceed 2,000 calories a day. A balanced meal is the best thing, and small portions. After that, of course, family history is very important. Anyone in the family who has had heart attacks before the age of 60, any kind of heart attacks or strokes or stents, bypass surgeries, puts you at higher risk for coronary artery disease. So I would highly recommend, if there's a family history, I would definitely do a stress test and get it checked out. Of course, one of the most important factors that contribute to coronary artery disease is diabetes. And diabetes is so common now because it's linked to obesity. So again, our best bet is not to become overweight, and therefore, again, calorie intake less than 2,000 calories a day is a must for everybody. One of the most important questions people ask me is, well, how much should I exercise? Again, American College of Cardiology puts out guidelines, and their recommendation is 20 minutes of brisk walking every day, 5 times a week. Nothing more than that. Of course, for other reasons you might want to exercise, obviously, but the minimum should be 5 days 20 minutes brisk walking or equivalent of that, like biking or swimming. One other important factor for coronary artery disease is hypertension. So it is of utmost importance after age 50. One should get a blood pressure cuff, digital blood pressure cuff, and measure the blood pressure daily. Make it a habit of measuring your blood pressure and maintaining a blood pressure below 140 over 90 millimeters mercury is recommended for heart health. So in summary, you should make sure that you walk every day for 20 minutes. You don't eat too much, and you stick to Mediterranean diet. Make sure your family history is not contributing to anything, and if it does, be aware and get a stress test. Make sure that you measure your blood pressure every day and make sure that it's less than 140 over 90 millimeters mercury. And don't ever smoke. In addition to that, be pleasant to other people, be nice, and don't ever forget, if you get angry at someone else, yell, shout, you are harming yourself. Nothing happens to the other person. You are harming yourself. So don't forget, be nice and pleasant to other people and try to be happy.